session as authorized under section 239 of the Municipal Act to consider adoption of closed minutes of meeting held September 15th, 2021, and a proposed or pending acquisition or disposition of land by the municipality or local board as it relates to property acquisition for the K&P Trail.
Any comments? All in favor? Carried.
Ron, I couldn't hear Jeanette at all. I know I have it in front of me, but I couldn't hear Jeanette.
Can you hear me now, Ron?
Are you there, Ron?
I think we just lost him.
I think
That was a.
Okay, so we're in closed session?
No, we're
Not yet. We're gonna be.
So for the presenters, we will be back.
For those doing presentations and that, we are going into closed session. We will be back at 9:30.
Yeah, maybe we can't direct.
Oh, you're there.
Okay, excellent.
Wednesday, October 20th, 2021, back to order.
Moved by Councillor Smith, seconded by Deputy Warden Doyle, resolved that council rise from the committee of the whole closed session without reporting.
All in favor? Carried. Adoption of minutes. Oh, is there any declaration of pecuniary interest in general nature thereof? Adoption of the minutes.
Moved by Councillor Smith, seconded by Deputy Warden Doyle, resolved that the minutes of the regular council meeting held September 15th, 2021 be adopted.
Any comments? All in favor? Carried. We have proclamation of GIS Day.
Moved by Councillor Rebel, seconded by Councillor McDonald, whereas Geography Awareness Week is November 15th to 19th, 2021, and whereas International Geographic Information Systems GIS Day is November 17th, 2021, and whereas Geography Awareness Week promotes GIS and geography literacy, and whereas GIS is an important part of geography awareness, and whereas the County of Frontenac is committed to expanding GIS awareness throughout the county in order to showcase real-world applications with GIS, now therefore be it resolved that the Council of the County of Frontenac hereby proclaims November 17, 2021 as GIS Day in Frontenac County.
Any comments? All in favor? Carried. Move into committee of the whole.
Moved by Councillor Higgs, seconded by Councillor Smith, that council adjourn and meet as the committee of the whole with the deputy warden in the chair.
All in favor? Carried.
Good morning, everybody. The first on the
Dennis.
agenda is.
Dennis. Microphone.
Oh, well, again, good morning. I think our first briefing is with Dr. Peter Oglaza. And Peter just joined us this Monday, so this is his first municipal meeting. So welcome, Peter. Are you with us? We're very pleased to have you on board.
Yes, thank you. Good morning, everyone. I am online. I cannot start my video. The message says that the host has stopped it, so that's the only limitation. I'm on audio, but not on video.
Is Angelique working on that in the background? Or? Peter, we're going to have Jeanette go out and check in the other room. We've got the control room outside. Just give us a second.
Thank you.
I have a copy of it here, but I don't think it'll show very good.
Oh, there we go. There we go.
Ah, there. We've got you.
Good morning. So there's also a copy of the presentation that was sent, probably also updated version earlier this morning. So I'm not sure whether that's received and can be shared with everyone on the screen.
I don't think we have a paper copy here, but is Angelique getting the presentation up? Yes, we have it on the screen now, Peter. So
that's perfect. Thank you so much. So with your permission, I'd like to start the presentation. And first of all, thank you very much for the opportunity to speak to this group today. This is a very significant moment for me, being the new medical officer of health for Kingston, Frontenac, Lennox, and Addington Public Health, as well as this is the opportunity for me to speak to some of the topics that are very, very important for me professionally and personally. When I was working in this region as a family physician in first Charlotte Lake and then Verona, as I was leaving my practice to go back into medical residency training to become a public health preventive medicine specialist, I was explaining to my patients really what's public health is all about, and how is that going to benefit them in the future. And this is really fantastic opportunity for me to be back serving the communities that I have previously served as a family doctor, and speak to you today about public health. So next slide, please. So public health is a municipally based service that's based on the Ontario Public Health Standards. That's a provincial framework, as well as embedded in the provincial legislative framework under the Health Protection and Promotion Act. This is the main piece of legislation. There's other pieces of legislation that we are involved with, but this is the primary one. Our Board of Health of KFLA Public Health consists of up to 9 board members, but we currently have 8. There's 5 provincial appointees coming from County of Frontenac, County of Lennox and Addington, and City of Kingston, as well as we currently have 3 provincial appointees. Next slide, please. So this depicts the what's the visual representation of the very diverse groups and sectors and partners and stakeholders that we work with as public health. We look at our municipal partners, healthcare partners, education sector partners, but also unique for our region, military corrections, and keeping in mind very important needs of the populations who are particularly vulnerable, making sure that these services are distributed equitably to all those in need, and also distributed equitably throughout the region. Next slide, please. Our structure, this might be a difficult slide to read on this screen, but what it depicts is the local public health structure that starts with the governance model that starts with the Board of Health, and then the next rectangle down is the Office of the Medical Officer of Health and our teams. And I wanted to, I'll maybe point out the one important portfolio that's very closely aligned with the work of the municipal sectors, the community health and well-being portfolio that I will speak a little bit later to explain our role with and involvement with the formulation of the community safety and well-being plans. Next slide, please. So this slide depicts a brief summary of what we were doing in terms of the COVID response. And these numbers there are just to demonstrate the magnitude of the work done in terms of the number of vaccine provided in our region, number of clinic days held in our region, number of various efforts throughout the pandemic response, only limiting the numbers to what was being done in 2021. One area that I wanted to bring your attention is the last 2 rows there that talk about the COVID cases. So this is all the follow-up of the cases that came up from our region, and as well as contacts. It was 1,268 just in 2021 alone up to the end of September, and 8,101 contacts. But these numbers do not include the help and the assistance we provided to the provincial pandemic response, where we provided case contact investigations for other regions that were very hardly hit, very significantly hit. And these numbers are, for example, 1,760 for the York region alone, 200 for Toronto. And the significance of that is that as it was even before some of that initiative was before we started seeing really the need for the provincial working together as a team, where our hospital, our healthcare sector would be receiving patients from other parts of the province and increasing the workload locally. So our work as public health on the prevention side ahead of that and throughout that time really contributed to us working well as the Team Ontario and working together to address the needs and demands from the pandemic response. Next slide, please. So now I'm going to switch to a bit of a discussion about our public health budget, and this is really something that is at the bottom of our presentation today, the deputation here. So we have some planning assumptions that are based on what we've heard from the province. And if I could have the next slide as well, please. So we've already started budget discussion. So this is something that we connect with our teams and review what the needs are to deliver the programs under the Ontario Public Health Standards, under the ongoing demands for the work. There are some assumptions that our base funding provided by the Ministry of Health, and that's the grant that's received and approved annually, is not going to be changed for the 2022 year. This is excluding some of the programs that were 100% funded, and that includes things like Ontario Seniors Dental Program, but also the COVID-19 School Health Nurses Initiative. And there's also other a number of programs that are 100% funded from different sources other than the Ministry of Health, and I'll go over them later as well. So what would be part of our assumption or consideration here that I wanted to bring to your attention, that we are hoping and anticipating that the increase to the municipal contribution will be limited to the inflationary pressures based on the consumer price index. That's something that still needs to go through the process with our Board of Health. So I won't share any more details at this point, but this is the heads up in terms of what magnitude of the change you may expect seeing from public health. And the next slide, please. Oh, this is my apologies. I didn't realize this is going to be so difficult to read on this big screen, on the screen here. But this is a sample that demonstrates what our budget looked like, cost share budget, indicating the provincial grant contributions in 2021. And that's basically to say that the size of the total budget from the base funds coming from the province was $13,250,600. And I think that's probably the most important figure here, demonstrate the size of the budget overall. And also, if we move to the next slide, we'll save your vision a little bit. The COVID-19 extraordinary costs were not included in that figure. This is a separate process that is taking place. And these are, our costs are submitted to the ministry. They're divided into the COVID-19 response as well as the vaccination program. They're separate. And these requests are going to the province on a regular basis for consideration for reimbursement. And that process will continue for the 2022 year, possibly maybe even into 2023, depending on the pandemic response needs in the next year. Next slide, please. And this slide highlights some of the work that's being done to date in 2020 with regards to regular work in our environmental health team, for example. So looking at routine regular inspections of food premises, looking at inspections of safe drinking water systems. So things that are basic infrastructure, basic services that are we often take for granted, and we want to make sure that these systems and all the appropriate legislation regulations are being followed. We continued with the rabies investigations. That's something that could not really change because we're the only agency that is responsible for doing those, and continue with the pool inspections. Next slide, please. IPAC inspection, very significant for the especially throughout the times of the pandemic, where we see large number of and demand for these inspections. Long-term retirement home inspections are particularly important, and this organization has responded to that need and anticipated that need ahead of really even the first wave in the province. And that's one of the reasons why our and working together with the sector, long-term care sector, that's one of the reasons why we were relatively spared in terms of long-term care burden of COVID on long-term care as a result of these joint efforts compared to the rest of the province. Next slide, please. This is some other examples of other funded programs that funding comes from other sources partially. We have these going. They are the one Food for You, Food for Two. That's an example of the program that's funded by the federal government, the Public Health Agency of Canada. It's $89,988, and KFLA Public Health provides approximately $80,000 of in-kind contribution. But this program, for example, addresses the dire need of nutrition in the critical period for mothers and babies. This is something that's really important. It's a significant need. Food security is an important issue, and this one program is an example of additional work that we do outside of the Ministry of Health budget, on the fixed budget from the federal government, with the in-kind contribution from this agency that the municipalities are contributing and helping fund. Next slide, please. More examples of these 100% funded programs. Healthy Babies, Healthy Children. That's the one that is 100% funded by the Ministry of Children and Youth Services, and it is approximately 1.2 million coming from that ministry. So many other examples of this additional important work that we are doing, and as I mentioned, funding comes from other sources 100%. Next slide, please. So thank you very much for this opportunity. I did allude earlier that we were very much aligned in terms of our outlook for health and our dedication to improve the health of and well-being of the communities that we serve. This is something that I mentioned earlier. Our goals and our public health standards and public health work is very much aligned with the risk areas identified by the County of Frontenac in your community safety and well-being plan. So that's something that we were part of, contributed to these discussions and prioritization, provided the background information data contributing to the process. And this is really what aligns us really well with all the work that's done by the county and all various services. And this is where I wanted to close with when I was reading the report, the community safety and well-being plan. I was very, very pleased to see all these initiatives happening, public health being part of it. This is exactly what I was trying to articulate to my patients in 2016 when I was leaving to do residency training in public health. Addressing these important health issues as a system, things that cannot be addressed by primary care. They need policy solutions. They need work together, public health, municipalities, and other agencies. This is something that I'm now proud to be part of as public health, and look forward to working together. So thank you very much. I'm opening this to questions if there's any.
Thank you, Peter, and we're also very pleased that you're here to help us keep our residents healthy across KFLMA. There's one program as you were going through the 100% funded programs that we get involved with at the health unit. And in our region, I guess we're known to have the worst Lyme disease in Ontario or Canada, or maybe even the world. So we did get $4 million from the feds to work with Queen's University, some other partners on that. So there are a lot of other things that the public aren't aware of, but thank you. And I'll open up to the floor for questions now.
I have a question when it's my turn, Dennis.
Okay, Bill's first, and then we'll come back to you, Ron.
Thank you, Mr. Chair. Peter, I'm just wondering where in the future on your agenda would you be addressing the threat, in my opinion, to community health, and that is the sale of illegal cigarettes that are quite available through the community. I personally envision that that's going to be a huge health issue in the very near future in regard to the sale of these unregulated cigarettes. I'm just wondering if you might have a comment on that. Thank you, Mr. Chair.
Thank you very much for that question, and through you, Mr. Chair. This smoking cigarettes is one of the significant preventable causes of disease, of mortality. It's present across the region. It is one of the priorities that are listed in our strategic plan to address, and there's many factors here to consider. There is work that has to be done underway to prevent youth from even starting smoking, and that's the important work that we do through our schools to address that. There is a new threat that was added very recently, or recently as 2018, where we started seeing more of an e-cigarettes, and we now know there's evidence to demonstrate that what we didn't know earlier, or didn't have evidence, that e-cigarettes are a gateway to smoking, and this is something that's particularly important for the youth. So there's line of work happening here to prevent people from starting. And the second line of work is working with the healthcare system, with our partners in primary care and in other agencies to promote cessation. So that's for those who already started smoking. And then lastly, there's also the need for those who already are suffering from the impacts of smoking. What we can do then to minimize the risk, or minimize the risk of them going back to the emergency departments and having these exacerbations of chronic disease resulting from smoking. So that's on the health side. In terms of prevention, I think is a really good opportunity for us to partner with throughout the region with other communities and see how this issue can be addressed. I know when I worked in Hastings, we were developing a good working relationship with our partners on reserve, making sure that we are working together towards that common goal of making sure children are not starting to smoke, and I mean, COVID all changed that and adjusted the priorities at the moment. But I think this is something that needs to be addressed. I know that there is really good precedents or paths that were paved by our colleagues from other regions, where they work very closely with communities and address the issue in a way that's respectful, and it doesn't. It basically is intended to build relationship and address the issue that's impacting everyone. So there's a lot to be done in terms of public health involvement on the issue of the actual response to the sale of cigarettes that are not coming from the regular distribution system. I mean, that's something that we'll need to partner with both the communities, but also the law enforcement. So that's something that would require a little bit more discussions. But in general, all of that should be addressed in the sense of respectful partnerships and looking at the common goal. And I think we all can agree on the fact that we should not have youth starting smoking cigarettes, and that's really something that's an overarching health goal, and that will help us to get on that one common page and find a solution moving forward.
We have another question, Councillor Higginson. Have you got a question?
Yes, I do. First of all, Dr. Glasgow, welcome as a new medical officer health. Looking forward to working with you. I must apologize. I couldn't see your presentation. I'm without power this morning, so I'm just on the voice. My question for you is, I think you've already answered it, but I just wanted to confirm. You said the increase for the will be CPI only for the municipal contribution. Yet you were mentioning there was some increased costs for inspections of long-term care and some other increased costs. Is that covered by the province, and can you still maintain a CPI increase only for municipal contribution?
So yes, thank you for that question through Mr. Chair. The idea here is that any costs that are related to COVID, any extraordinary costs related to COVID response or vaccination, are eligible for these extra for the one-time grants from the province, and we have a process for that. So our goal is to make sure that increase for the municipal sector does not exceed that in inflationary pressure or the consumer price index. That's the goal, and we will make sure that any eligible costs, additional costs that we've incurred through our pandemic response are submitted to the province for reimbursement. So that's the commitment we have. And in terms of the actual figure for the municipal contribution, there's still going to be deliberations with our Board of Health, so I cannot really speak ahead of these. But that would be my proposal to keep it at that consumer pricing, that cap.
Thank you, Peter. And the province has been very good with supporting COVID, so we've got quite a few, I guess, a few million over that now, so we're not doing too bad there. Any other questions? Yes, Fred.
Through you, Mr. Chair. Doctor, just looking at some of the data that you had earlier regarding COVID cases, and that's 1,268. What does that reflect? It wasn't really clear to me.
So this is the slide that all these summary numbers are provided is the year-to-date numbers for 2021, and I believe that's up to the end of September. So this is the number of distinct COVID-19 case investigations where we receive a positive lab result, and our team reaches back to that individual, tries to determine where they might have acquired the infection, looks at who else might be at risk, and then that's what then results in the follow-up with contacts. So usually a person would have a number of contacts, then that's the second number, contact investigations to date for 2021. So that's why it's only 1,200. The total number, including the 20 cases, would be 1,700, around 1,700. But this is only for 2021.
Thank you. Any other questions before we move on? Okay, I want to thank you very much, Peter, and have a good day.
Thank you.
And I believe we got the Kingston Frontenac Public Library coming on this. Laura Carter's joining us. Do we have Laura coming up? Oh, there she is. Good morning, Laura. Welcome. And typically we try to keep these briefings to about 10 minutes, so I'll let you have the floor and give us your presentation.
You and I do have some slides as well, but I'll begin while those get loaded up. So thank you for inviting me to speak about the Kingston Frontenac Public Library's draft 2022 budgets. My name is Laura Carter, and I'm the Chief Librarian and Chief Executive Officer of the Kingston Frontenac Public Library. Joining me this morning are Christina Ridgely, the library's HR budget analyst, and Monica Stewart, the chair of the Kingston Frontenac Public Library Board. I should note that these are very much draft statements in that the library board has not even yet passed them, so they will be presented to the library board later today and then go through the City of Kingston budget approval process in November. Next slide, please. So we did recently pass some new end statements, so I thought it was important to highlight these. The library board uses the policy governance model developed by John Carver. The board met several times in May and June to revise its ends. Ends are different than a mission statement. Under the policy governance model, ends are statements about the purpose of an organization, why it exists, rather than what it does or how it does things. So end statements are about one or more of these three things and only these three things. So they define the benefit or results of an organization's work, who the beneficiaries are, and what it's worth to produce those benefits. So if you'll forgive me, haven't memorized them quite yet, I'm going to read them. The Kingston Frontenac Public Library exists so that urban and rural residents have access to resources, services, and programming that support personal enrichment, digital equity, information literacy, and meaningful societal participation through effective stewardship of public resources. So that's what's called our global end statement. Additional detail is then provided if desired, and the board settled on 3 statements providing additional detail. Residents and visitors find welcoming, inclusive public spaces where they can build a shared sense of community and belonging. People engage in intercultural experiences and expand their awareness of social issues. Next slide. Library spaces, collections, and services are responsive to people's needs and lived experiences, including those facing systemic barriers. Library resources and services are accessible and culturally relevant. Indigenous members in the service area experience decolonized and indigenized library services. And community members find opportunities that spark imagination and ignite creativity. Next slide, please. So these new ends will guide us as we develop a new strategic plan and a new facilities master plan later this year and early next year. After a senior manager retired earlier this year, we reviewed the library's organizational design and made some adjustments to our management portfolios. We now have a director of facilities and technology and a director service design and delivery who has responsibilities for branch operations, programming and outreach, and the library's collections. At the manager level, there are 3 positions: facilities, programming, outreach, and branches and collections. And we'll continue to review this design as we develop the new strategic plan and ensure we remain responsive to our communities. And we're currently, speaking of being responsive to the communities, we are currently undergoing a branch hours review, and we have a survey active soliciting feedback right now. Surveys can be filled out online, and we also have paper copies available in every branch. We've had a fantastic response so far with over 1,500 surveys collected. So we'll use the data from the surveys. We'll look at things like visitor counts, what time of day they come in, what time of day the books are being checked in and checked out, and we'll look to make a recommendation to the library board early next year to adjust our hours of operation. Next slide. So the budget presentation provides an opportunity for me to highlight some of the library's programs and services. So particular interest for the county, we're looking at a connectivity audit at the moment. We're trying to make sure that we have the best possible speed for our internet service at the best possible price. And that's ongoing right now. We're working with the city of Kingston to migrate some of our servers to their facilities where they have additional capacity for backups in the case of power failure. And it makes sense to share these services. Not very exciting, but a Microsoft Office upgrade will help us work more efficiently. At Howe Island, the township provided new flooring and new paint earlier this summer. So we partnered with them in packing up the collection and rearranging it a little bit. So we were closed for a few days there, but the branch you can see in that photo looks really good. For radon, we've had radon levels of concern at the Pittsburgh branch in the city and at Cloyne and Sharbot Lake. We're working with the townships on monitoring and remediation. And I'm very pleased to say we'll also be loaning radon detectors to library users. So this is a partnership with public health and educating people about the dangers of radon. Next slide, please. On the programming and outreach side, don't worry, I'm not going to speak about all of these programs, but COVID has had a huge impact on our programming and outreach activities. We were grateful to be able to begin to attend outreach events this summer and fall again. We were at Open Farms, we were at the Battersea Pumpkin Festival, and our Grown Up Story Time and Right On programs in Sydenham have continued or restarted. The majority of our programs do continue online for now, and many can be viewed on our YouTube channel. One of the most exciting additions to our YouTube channel this summer, I thought, was our Meet the Maker series, or Meet Your Maker series. This was a partnership with Frontenac Business Services and Susie Lamont Photography. The series of 6 short videos featured local musicians, food producers, farms, and artisans, and these were all people featured from Frontenac County. We also offered several take-home crafting kits where people could come to the library, pick up materials, and then watch a video tutorial on YouTube to help them complete the craft. Next slide, please. Some more of our online programs here with one that I wanted to highlight, which is our Circuitry Discovery Kit and Robotics Discovery Kit. So we initially launched these as sort of programs to send the entire kits up to a specific branch. We wanted to make sure that patrons in our rural branches, so we started with Cloyne, Sharbot Lake, Wolf Island, and Sydenham, that they had access to these really exciting resources and were aware of them. They are now available to be reserved individually and can be borrowed by anyone across the system. Next slide, please. So under services and collections, we were very fortunate to partner with the Alzheimer's Society and receive a grant from the United Way, Kingston, Frontenac, Lennox, and Addington to provide reminiscing kits. So these support people who are caregivers for people living with dementia. There's books, games, puzzles, other simple toys that people can use to help spark imagination, give people something to talk about and work together, and help support the caregivers for people living with dementia. Our hotspot and Chromebook lending project, I think I talked about that last year. We were able to get another grant leveraging the funds that we received from the Community Foundation for Kingston and area. And so we now have 30 hotspots that are circulating throughout Kingston and Frontenac, with the majority of them being located in rural branches for county users. Next slide, please. Only a couple more to go before I get to the numbers. So we have added a part-time publicity assistant to our staff this year, and the results have just been amazing. So our newsletters are now more specific. You can sign up for age-based if you want children's programs, or if you're more interested in adult programming. They're going out on a regular basis. We've done, we're in the middle right now of 2 marketing campaigns. So we're advertising our fine-free status, and we're also launching a library on the go campaign. So you'll see signs, ads, bookmarks. We're going to have pop-up banners in the city and in the county, newspaper ads, encouraging people to sign up for a library card on the spot online to get access to our digital collections. We shared a story just recently from Mark from Sydenham, telling us how much the library means to her and her experience using the library, and we'll continue to share those stories to get the word out from actual KFPL users. And then finally, I mentioned the branch hours review already. We did a survey about feedback for our COVID programs and services, and we've launched a Net Promoter Score. So this survey goes out to a random sample of patrons who've used the library in the past week, and it asks them a few brief questions about how their experience was. It gives us a snapshot on an ongoing basis of how we're doing and allows us to respond to questions and concerns. Next slide, please. So a few numbers. We do have 11 branches in the county, 5 in the city. Right now we have about 5,000 registered cardholders in Frontenac County. That's holding steady from the number I presented last year. Year to date, so January through the end of September, we had 60,586 items borrowed in the county. This is an increase from last year, but still not quite back up to our regular levels. It does represent 13% of our overall circulation. Internet and Wi-Fi numbers are there, and that is 18% of our overall Wi-Fi and internet numbers, again, highlighting the need for increased and better internet access in Frontenac County. And for 13 weeks this year, we were on curbside only service due to COVID restrictions, but the Frontenac County branches are now all fully open for all of their regular hours. And big thanks to the townships who do provide those facilities and are responsible for cleaning them, for working with us to make sure that we could fully reopen to the public. Next slide, please. A few digital service trends. So that online uses number is our website visits and online renewals. And again, this is year to date. We're looking at 6,800 virtual reference questions that have come in. Our ebook, audiobook circulation continues to grow, and then streaming services. So that's Canopy, where you can watch movies, Hoopla, movies, music, ebooks, audiobooks, and there's some fantastic resources that people can get right from home. Next slide, please.
Laura, we're well over our 10 minutes. Are we got many more slides here?
I'm getting to the numbers, so I'll go on. I think you know how the library is funded: 87% from the city, 13% from the county. Next slide, please. Again, the city provides the facilities. Those aren't part of the cost sharing. They appear only for the city side, and the townships provide and maintain the facilities in the county. Those aren't reflected in this budget. Next slide. Again, lots of pressures on our budgets. I'll highlight the inflationary rate, which came out this morning at 4.4%. That really takes a hit on our collection budget. Next slide. Okay, here we go. So we are asking, I just got to move my face here. We're asking for an increase from the county of 2.25% over last year. So that's a $19,953 increase, bringing your contribution to $906,458. The difference between the city and the county portion, again, is because of the shared and unshared costs when it comes to facilities and sometimes technology. We don't have any indication that the province's contribution is going to change. We are forecasting a slight decrease in self-funded revenue. That's room rentals, photocopying, which of course are impacted by COVID, and lost materials. Our total budget increase is 1.89%, bringing our 2022 draft budget to $8,331,648. Next slide, please. So here's a bit of a breakdown for where the increases are coming from. Our staffing costs, of course, are the bulk of our budget, and we're looking at a 2.15% increase there. That's increase in benefit costs, slight increase in overtime for extra cleaning on Sundays, and then staff increases. We are going into a new collective agreement, so next year will be a negotiating year. Asking for 1.5% to keep our collection material up. Again, that is less than inflation. System-wide costs are sort of contracted services, largely that what comes in there. So our integrated library system and the ongoing operating costs required for other software packages. Facilities, that's solely for the city of Kingston. Next slide, please. So briefly on our capital budgets, the good news here from the county is that what we discussed last year with the city treasurer and county finance staff is with our surplus budget last year because of COVID, rather than sort of trying to figure out returning funds to the county, the contribution required for capital from the county will be funded by the library reserve, which is where the surplus from last year went. So while it indicates $45,500, we will not actually be collecting that money from you. Next slide. And then we are asked when we submit our budgets to the city to provide projections for the 3 future years. So I'm presenting those for your information. Last slide. That's everything. Thank you for your support, and I'm happy to take any questions.
Thank you very much, Laura. I'll open the floor for questions. Do we have any questions? It looks like you've covered everything, and I think that also means we're very, very pleased with the service provided by the public library. I know we are in our community in the islands. So thank you very much. So we'll move on to the next presentation, which is Ruth Nordograph and Mitch Granger from the City of Kingston Housing and Social Services. Hi, Ruth. Nice to see you again.
Hi, members of council. Good morning, and thank you so much for the opportunity to share our housing, early years, and social assistance information for your for this meeting today. I do also have some slides that I think Anjali can put out. I'll just give her a second. There we go.
We generally expect about 10-minute presentations, so.
Yes, I think I might even be less than that. We'll see. So, so thank you so much for having me today. It's just me to this morning, but I did want to point out that there are two, and yeah, you can go to the next slides, that I have two of my colleagues in the Housing and Social Services team that are kind of the leads for the Social Assistance and Early Years team and the Housing and Homelessness teams. And during the year, there may be some interactions with them. So Heather Mitchell and Mitchell Granger, we did not pick them for the names, but just wanted to point out that those two are two of my colleagues that are working with me in the Housing and Social Services team. So in the next slides, I just wanted to very quickly provide an overview of what I wanted to bring to you today. I do think that you have a very good understanding of what we do, so I will not spend too much time on it. And I know you're probably quite keen to see, what our draft budgets will look like moving forward. So I'll just highlight kind of our role as a service manager in various areas, what we've seen in 2021, and then of course looking ahead to 2022. So the next slide. I just wanted to highlight to County Council the service manager role, and again, I think you're quite familiar with it, but it's always good to highlight it. So as a city, as the city of Kingston, we are filling that service manager role for the three areas in our department: the housing and homelessness services, the social assistance services, and the early years childcare and early years programming. So as a city housing and social services department, we are providing both the direct services for the social services, social assistance, and also the administration of the indirect services in the housing and early years area. So the next slide, I just highlighted kind of the primary services that we are delivering in the County of Frontenac. And again, I think you're quite familiar with them. So first of all, we are providing the social assistance or Ontario Works case management to clients that are in receipt of social assistance in the County of Frontenac. In addition to that, we are also providing the discretionary residency benefits for clients on Ontario Works and also Ontario Disability Support. The second area, and I know that's been a very hot topic over the last 18 months or so, is our work supporting the housing and homelessness programming. Of course, we are managing the social housing wait list and the social housing portfolio, and I will skip to that in a minute. We also are administrating the homelessness services in both the city and the county, and we have a variety of affordable housing programs. And last, but certainly not least, is the services that we deliver both within the subsidies towards childcare, the operational funding towards childcare centers, and the early on drop-in programming for parents and children between 0 and 6. So the next slide. And I know this might be a bit hard to read, but I wanted to highlight this service, specifically the services that we are providing in the county for those three areas. And of course, the pandemic has really changed some of the numbers in 2020 and 2021. So we are very curious to see what next year's numbers or what the numbers for the next few years are going to look like to have a better sense of the trends. For the social assistance, I wanted to point out to council that we've seen quite a bit of a decrease in caseloads. For the county, we've seen 24% decrease. Currently 193 individuals are on the caseload in the county. And one of the main reasons are obviously the various federal COVID-related benefits that people have been able to access. So we certainly are, planning for the next steps should those benefits be ending. On the housing and homelessness side, at this point in the county, there is a total of 55 social housing units. A combination between the housing units at the Lower Housing Corporation, units in North Frontenac, and also rent supplements and portable housing benefits. I will say that the number has currently been reduced, obviously because of the McMullen Manor fire in early January 2021. And I know KFHC is currently working through the process of the rebuild for this project. In addition, we are funding the Salvation Army that it has an office in Verona that's providing the rural services in homelessness prevention and are working with various agencies and individuals in the community. We also are providing both the Kingston Frontenac Renovates program and the home ownership program. I have included the numbers for 2020 of how many kind of projects in the county we've supported. And again, the uptake in 2021 has been very low because of the pandemic and also the reality of the prices of housing right now. So again, looking forward to being back hopefully here next year with some better data, but 2020, 2021 has been a bit challenging to really give you a good overview. On the next slides, I also wanted to highlight the childcare and early on data that I wanted to bring to you. As of August 31st, 2021, we've been able to serve 31 families with 39 children with childcare subsidies. We continue to fund the rural Frontenac Child Center and the Lowborough and Elginburg before and after care with operating funding. And we've continued to operate various early on programming during the pandemic, both virtual and in person. So we're quite proud of the ongoing amazing work of all the partners in the county. So the next slide. This is, of course, what you will be looking at. So our budget is obviously a budget that's based on our kind of agreed upon kind of shared agreement of how we're kind of budgeting our funding. And I will say, and I know our CFO is on the call today as well, that this is a draft budget and that our city council will be meeting later in November to review the budget. So I do want to point out that this is a draft, but I can appreciate that you would like to see what we're projecting at this point. So in 2021, the projected budget was 1.77 million between the three areas. And our draft projections and budgets indicate that we are seeing a slight increase towards 1.827 million. Again, I have provided the breakout here. And again, this breakout is really, based on the kind of shared cost and also the actual costs for specific units, for instance, housing units, childcare, subsidies, etc. So the next slides, or the next three slides, I should say, and I will probably not spend too much time on every detail. I just wanted to provide you again that draft breakout of the various elements in all the three areas. So here you will see for the Ontario Works programming, we are projecting a total of $888,000 approximately. And on the next slides, you will see, and I know this is a very detailed slide, but the Children's Services budget has a lot of different subcategories and provincial funding and provincial contributions. But the subtotal there is about $254,000 that we're projecting for the county contribution. And then on the last slide, you will see for the housing and homelessness projections, a total of $683,000 for the housing and homelessness contribution. So on the next slide, and I'm almost there, just looking ahead for the 2022 programming and what you can expect for the county. First of all, and we were just in our city council meeting last night, We have finished a homelessness system review, including a rural components. And right now we are going out to procure our homelessness system components, including the rural services. And we obviously will, and we're working closely always with our county partners, but we will keep you posted on what that looks like moving forward. We obviously are also very aware of the changes through the pandemic with our early years and childcare services. So we were already starting on an early years strategy prior to the pandemic, but we've put that on hold during the pandemic, and we'll start that strategy up again. And this year, obviously moving into the 2022 year. And again, we'll really make sure that there is, that you as council will be informed and aware of that process. And last but not least, again, the pandemic has really changed the way of providing services to clients, including clients in the county. We have offices in Sydenham and Charlotte Lake, but obviously have not been in those offices face-to-face much and have really utilized more or other ways of connecting with clients. And the province is also innovating various service delivery. So we are using that to go through also a social assistance renewal process to make sure that we can kind of continue what worked during the pandemic, but certainly also at some point go back to more a hybrid model between face-to-face and digital service delivery. And I think, if I am not mistaken, if I go to the next slides, let's see if I'm right.
Don't see it. No,
I think that's it. So that's an overview of what we do, and happy to answer any questions.
For Ruth? I guess well presented briefing, so thanks very much. We don't have any questions for you.
Thank you for having me. Have a great day.
Well, thanks for joining us. And now we got Desiree Kennedy joining us, who's the City of Kingston Treasurer, who most of us know. And welcome. And as I said to the other presenters, we'd like to keep these to about 10 minutes and then questions.
Thank you very much. Thank you. And I definitely try to keep this within the 10 minutes. It's a smaller budget, so it shouldn't take me too long to get through it. If we could get the presentation up with the slides. And maybe while that's happening, I'll just do a couple of introductions. So normally you don't see me doing the provincial offenses presentation, but we have a new Director of Legal Services and City Solicitor who's responsible for provincial offenses, who has just taken on our City Solicitor role, Jenna Morley. And Jenna is with us today. But we've given her a bit of a reprieve since she's just started. So we're helping her out today in terms of the presentation, but next year she's on her own. And we also have today Wendy McCafferty, who's our administrator of the Provincial Offences Court. So if you ask any real tricky questions, we've got Wendy here to handle all those hard questions. So thanks again for the opportunity to present the provincial offences budget to council this morning. And maybe if I can just get the slides advanced, 2 slides, please. So I thought I would start just with a little bit of introduction and talk very briefly about some of the operational changes within the Provincial Offences Office. I'm sure, as most of you know, the Provincial Offences Court's responsible for processing a number of different charges under a variety of acts. Primarily under the Highway Traffic Act, but certainly we also have a number, under other acts as well. This budget presentation is a little different from the other ones that you're hearing this morning, because it is actually a net revenue budget to the county, which is good news. The other thing that I just want to mention as we're going through and talking about some of these operations is that the budget is actually on a cash basis. And so for accounting purposes, we don't record the revenues even when they're billed. We actually don't record them until they're actually received. and just because of the uncertainty of the collection. So the numbers you're seeing are on a cash basis. There's been a couple things just to note. Excuse me. The provincial legislation did prohibit our collection efforts in 2020 from March through till the end of the year as a result of the pandemic. And so we certainly saw a drop in the revenues in 2020. And we're continuing to see that actually in 2021 as things sort of transition back to whatever our new norm is. We've also seen, obviously, through the pandemic, a number of charges. The number of charges has also been greatly reduced from the enforcement agencies. And I've got a slide just to give you a bit of a snapshot as to what those numbers look like. On the expense side, we have got some cost savings that are reflected from a couple of things. Certainly the use of virtual court proceedings is creating some savings at this point. And we've also brought some activities in-house related to issuing the notices of fine and due date. And certainly Wendy can provide more information on that. But just in an attempt to try to offset some of the reductions in revenues, we've certainly been taking a critical look at the cost pieces as well. Next slide, please. Just wanted to give you a quick snapshot on where we are in 2021. You'll see in 2020, and these are gross numbers. This is not the county share, this is the total. So you'll see in 2020, we had a net revenue of about $120,000 with revenues just under the $900,000 mark. Previous to that, we had been budgeting revenues at 1.6 million. So about half coming through the pandemic. In 2021, up till the end of September, our revenues are at $634,000. So again, I think projecting to the end of the year, probably going to see revenues of around $800,000 to $900,000 again, against the budget of 1.6. We certainly were optimistic with our 2021 budgets, and it was a little bit of a wild guess, as it was with a number of things in preparing 2021 budgets with what recoveries were going to look like, and certainly we were optimistic on the revenue side for 2021. Next slide, please. So this slide just gives you a bit of history going back to 2016 on the revenues, which you can see the far right-hand side in light blue, and the number of charges. And we started to take a much closer look at this, certainly coming out of the pandemic, to try to determine what our baseline number should be. And as I mentioned, it's been around the 1.5, 1.6 mark. Taking a look at some of this history and maybe ignoring 2020 and 2021 because of the pandemic, going back the previous 2 years, we were probably closer, well, we were closer to the 1.3 million as opposed to 1.6. And you can see 2017, which obviously was an anomaly year, was just over 1.6. So we are looking at, in this budget, reducing our revenues, both with respect to ongoing recovery with the pandemic and some of those implications, but also looking at our baseline revenue, which we feel at this point probably should be closer to the 1.4, maybe up to 1.5 million over the next 2 or 3 years. And you'll see in the projections that we've actually incorporated that in. Next slide. So I won't spend too much time on this slide. This is just giving you a bit of a breakdown of those total number of charges. And you can certainly see again, down in 2020, down in 2021, but tending to be somewhere around the $8,000 to $9,000 mark for charges, with the majority of them with Kingston Police and OPP. Next slide, please. So this is our draft budget. And so we are showing for 2022, we have a net revenue on this budget of about $276,000, of which the county share, which is 20%, so roughly it's an 80-20 split. So for the county, it would be just over $73,000 credit to your budget. And you can see on the revenue line at the very top where I've mentioned in 2021, we had budgeted 1.6. We've dropped that to 1.2 million in 2022. And that creates a $243,000 share for the county. But if you go over to 2023, 2024, and 2025, you'll see that going back up. And we're really looking at bringing those revenues at this point, forecasting up to around the $1.4, $1.5 million mark at this point as we continue to review those. I just do want to mention, as Ms. Nordograph did, these are draft numbers. We don't anticipate there being any changes at this point, but we do go to City Council on November 23rd to table our 2022 budget, and so certainly subject to any changes with respect to that. So that's our budget presentation for provincial offenses, and along with my colleagues on the line today, happy to take any questions. Thank you.
Thanks very much, Desiree. Fred has a question.
Thank you, Mr. Chair. Just one question. What is the breakdown as percentage from a fine that is paid go to the either the municipality or the county, and what part goes to the province? Just is there a figure that we can look at regarding that?
So the city to the county breakdown is roughly 80-20. But I don't know, Wendy, if you've got, if there's a percentage share of the ticket revenue that goes to the province?
Sure. Okay. So on most tickets, just a ticket that somebody would receive at the roadside, it's a scale. I have some information here, just a moment. It's almost like a percentage. So on a fine of $110, the province would receive the victim fine surcharge on that, and it would be $20. So $15, $20 on each ticket that's issued generally would go to the province. The rest is the set fine amount. That's what's split between the county and the city.
Thank you.
Any more? Yes, Councillor McDonald.
Yes, thank you, Mr. Chair. I'm just wondering, what's the amount of unpaid fines that you might have on the record at this point? Thank you.
Millions and millions.
Yes, that's correct, actually. So I actually had a slide and I had taken that out just in essence of time. So the total receivables up to the end of Q2 of 2021 is about $7.9 million. And the majority of that is older fines. So you'll recall, and my schedule, I can't recall when the province downloaded this, but of course, a huge amount of collectibles came with that download. I'm back to 2016, and we were at we're at 14 million at that point. So we've gotten it down now to about 7.9. And Wendy may have more information, but I would say that the majority of that number is very old fines that are probably uncollectible at this point. A number of them being that were downloaded from the province originally.
And Desiree, I think we got that down a lot by writing off the old debt. I don't think we really collected a high percentage of it.
You're right. That's correct. Yes, I think we did write off a portion of it.
Okay, any more questions? Well, I think that's it. Thanks very much, and have a good day.
Thank you very much.
And next we have South Frontenac Community Services, and I believe David Townsend's with us. I did see David on earlier.
Still here. Thank you. Good morning. Thank you for having me. Angelique, you've got my slides there. So if you would like to put them up, I will be as brief as I can be.
Yes, you heard the message, 10 minutes.
Yeah, and appreciated too. So, and we'll just go straight to the next one once you're up. So just a little bit of history. Last year and previous years, the county has been very gracious in providing $48,000 for the provision of rides. As we know, COVID had a little bit of a blip in getting volunteer drivers and people to medical appointments with telephone visits and everything happening. We're asking for 2022 that we again be funded at the $48,000 mark. We don't really have any serious projections on how many rides we're going to do, but we do know that they are trending up again. And this will just ensure that as our world returns to whatever our new normal is, we're going to have a chance to meet the needs of the seniors out here. The request is also going to ensure the financial sustainability of our model. Next slide, please. So our plans for this year have been to rebuild the volunteer base. Prior to COVID, we had 57 drivers. By June of this year, we were down to 11 because of fear with COVID. We've been working very hard at rebuilding it. We are up to 34 drivers, mostly for the Meals on Wheels programs. We're trying to rebuild seniors' confidence in safe volunteer drives. Our agency has now instituted a policy of mandatory vaccinations for all staff and volunteers so that our seniors that we're driving know that they are in a safe environment as they get to and from appointments or whatever they need to do. Next slide, please. So just some basic data. You've seen the pre-COVID numbers before. You can see what the impact of COVID has had on us in the middle column. With the Meals on Wheels absolutely going through the roof. But by March 22 at our fiscal year end, these are the numbers that we're projecting. And as you can see, all programs are starting to rebound, which is a very good thing and a very good projection for us. Next slide, please. So transportation stats year to date. Hospital trips are the big one that is, call it a red flag. There have been no visits to hospital because of a lot of the surgeries have been canceled or postponed due to hospitals being overflowing with COVID stuff. But those are the number of trips, the number of kilometers driven. A previous year prior to COVID for kilometers driven was in the ballpark of 150,000 kilometers. So the drives are very local, but there's coming back. Next slide. So 2021, I thought I should give you a breakdown of why we're asking for the continued funding. In 2021, our fundraising was up by 105,000. The Canada Employment Wage Subsidy provided 92,000 in wage subsidies. And with the help of yourselves, the township, the LIN, maintaining our base funding, we were able to keep all staff employed. So none of our staff had to, sort of go on the CERB or anything else. So we were able to respond very quickly during the entire pandemic to changing needs. Knowing that our fundraising and the queues were up by almost 200,000, we still had a surplus of 76,000 on our revenues there. So it kind of offset a whole bunch. And once the fundraising is back to normal and the queues disappears, we hope our revenues are back to normal and we'll be breaking even again. Next slide, please. So our next steps, we are continuing to advocate with Ontario Health East. I've actually had some very good conversations with them this year, where based upon our current service delivery, they now understand that we're underfunded by $229,000 a year on our $600,000 funding. Doesn't mean there's going to be more money coming, but at least we finally have an understanding that the supports that we get from everyone is sort of a band-aid to make everything fit. I'm still very active with the Frontenac, Lennox and Addington, Ontario Health Team, and know that that's going to play a huge part in healthcare delivery over the upcoming years. Heather Rogers has stepped into my role. She's now looking after the activities within the four walls of this agency, and I will continue to work with Ontario Health Team, the county, the township, and our capital fundraising campaign over the next 12 to 24 months. Our next steps, we're still on the process of trying to explore integrations that are going to save administrative dollars and be more efficient in the use of funds. As a good example, Louise, I'm putting you on the spot, but Louise and I have a luncheon tomorrow where we can talk more of what things in common we can explore between rural Frontenac and Southern Frontenac Community Services. Next slide, please. So these are also other next steps. We want to explore growth areas. Can we or should we increase to 4 or 5 days a week? The virtual program capabilities. We have 41 tablets in our lending library. So similar to, through the public library, where we're reaching out to people who may not have the tech or the hardware to connect virtually. And then later this year, and I will be back in touch with the county, we are launching a fundraising campaign to upgrade the Grace Center, removing the portables and providing a professional home for everything that we do here in South Frontenac. And next slide, I think, is questions. And I think I'm under 10 minutes, Dennis, or sorry, your worship. Any questions for me?
Maybe we'll have to save that for Louise. Any questions from the floor? And
Yes, I was.
Yes, Councillor Higgins, you're with us?
Yes.
Go ahead, you got the floor.
So David, I noticed in the next presentation by Louise that she's going to be recruiting drivers in South Frontenac and Wolf Island. So I just wanted to know if you and her have been discussing, the question is more for her than you, I think, but are you aware of her recruiting drivers in South Frontenac and Wolf Island?
No, I'm not.
Okay, thank you.
Okay, we'll hold that till the next presentation. Any more questions? I don't see any, so I want to thank you again, David, and we'll hopefully see you soon.
Thank you very much.
And as Ron just said, Louise is joining us, Louise Moody from Rural Frontenac Community Services. And I'm not sure if, yes, you also have Nikki. There she is. Hi, Nikki. Okay, you've got the floor, and we've been asking people to keep to about 10 minutes. And we've got your presentation up.
Awesome. Nikki is going to take the lead on this presentation. Thank you, everyone.
Yes, good morning, and thank you for having us. I didn't put it in my presentation, but my ask again is the same as last year for the 48,000. We don't see many budget changes from what we had this year. And as you know, I presented most of that in our previous presentations when we did our road trip. But again, thank you for having us. Frontenac Transportation connects people of all ages to a wide variety of services, empowering them to live rural life to the fullest. Next slide, please. Transportation is essential for everyone living in a rural community. We are committed to getting people where they need to go. We want to be where residents call to access transportation for all of Frontenac County. For people without their own transportation, Frontenac Transportation is a vital link to their community for their health and well-being. We often hear people say that without our rides, they would have to move to the city where public transportation is available. Next slide, please. We provide a user-pay volunteer transportation service to any resident 7 days a week throughout Frontenac County. Our services allow seniors to age at home. They are able to attend appointments, go shopping, and participate in social events. Our services ensure that all rural residents can get to medical appointments, hospital treatments such as dialysis, basically 3 times a week, and daily chemotherapy. We support children and youth to access services they need, including daycare, school, and community programs. Next slide, please. We couldn't do this without our volunteers. Currently, we have 23 and also a couple of spare drivers as well. 2 in North Frontenac, 15 in Central, and 6 in South Frontenac. And we are currently recruiting in Frontenac Islands. Our volunteers donate over 10,000 hours of driving for Frontenac transportation in a year. And as I said before, if you didn't know, that would cost us about $151,000 if we were to pay them minimum wage for their time that they donate. Next slide. 2 years ago, we completed a business model. We looked at various ways to cover costs while just delivering accessible transportation to rural residents who didn't have private transportation. The county funding contributes to the infrastructure required to staff an office to dispatch rides. We provide rides to seniors, individuals, children, and youth, often paid by third parties, which provide the majority of our revenue. The revenue we earn from third-party rides, we use to cover the staff and office and to subsidize rides and cover mileage to and from clients' homes. Third-party rides for clients receiving OW, ODSP, and for organizations who need transportation for their clients. For example, Tri-Board Transportation, childcare, Veteran Affairs, and anyone else. And we charge 60 cents a kilometer to those other agencies. For those without funds to cover the actual cost of the ride, we subsidize these rides for people. So for people, a person who needs dialysis 3 times a week in either Kingston or Smith Falls, the cost is further subsidized to make it more accessible for them and to fit within their budget. Next slide, please. This is where we spend our money. Our operational budget this is without volunteer reimbursement. It totals about $113,000 a year. We have 2 staff members who staff our office 5 days a week, taking calls in person and during office hours. After office hours, our phones are monitored 2 to 3 times in the evening, 4 or 5 times a day over the weekend, and any messages that are left that are urgent are returned during that time frame. So again, a 7-day-a-week service that we provide to the county. We've been running a monthly advertisement recruiting drivers in all of Frontenac through the Frontenac News. It has been highly successful for us. We have recruited 6 new drivers in the last 6 months, and 2 of my latest recruitments are from South Frontenac, and they are willing to drive in the islands. So I have some clients in the islands, potential clients that we've reached back out to that have inquired in the past. So hopefully in the next month or so, I feel that Frontenac Transportation will be servicing that area. I guess our budget breakdown is our overhead is about $21,624. We pay rent of $12,000 a year. Advertising, volunteer appreciation, writing off bills that have not been paid is just over $5,000, and we spend on average about $75,000 in salaries, which brings us to the $113,674 a year. Next slide, please. Again, this is, I'm sure, familiar to many of you. This was our Q1 and Q2 expenses that was submitted to you, and you'll be receiving Q3 in the next week or so as well. But that's just another breakdown of what we spent so far this year. We've served 257 unique individuals, 56% were seniors. As you can see, our data, we received almost 3,000 calls and dispatched over 8,000 rides so far in this year, and we drove over 520,000 kilometers. As I said, we're currently recruiting for Frontenac Islands, but this is a breakdown of where our riders come from. Next slide. We go the extra mile. During the pandemic, Frontenac transportation drivers made it possible for youth across Frontenac to receive program supplies, giving access to virtual programs addressing the youth mental health crisis in our area. We delivered takeout meals to support our local restaurants, groceries and medication to individuals self-isolating, and even flowers to a resident who had lost a family member to COVID during the lockdown and was unable to travel to be near family members at the time. With your support, Frontenac Transportation Services can make a difference to all residents in the county every day. We have a vision for a seamless transportation system to all residents of Frontenac County. Thank you for having us today, and I hope you enjoy the rest of your afternoon. Any questions?
Thanks very much, Nikki and Louise, and we do appreciate the service you provide across the county, and very pleased to hear that the islands are being recruited now. Yes, Ron.
I was just wondering, as COVID hopefully keeps heading the right way and relaxing and rides start going up, do you see 50 cents realistic at $1.50 gas? I know people are volunteering their time. That would not cover their remuneration for their vehicle, would it? Are you seeing that staying at 50 cents, or I think that's going to have to be modified?
We've been monitoring it since June, and we're currently proposing a change in a bit of the mileage, and it's hopefully going to our board in the next month. Possibly, I agree 50 cents might not cut it. We might have to do an increase with the rising fuel costs.
I think is fair. I mean, if people want to donate their time and everything else, I think that at least they should be cost recovery for their expenses. Thank you.
Any more questions?
Yes, Dennis, I have a question.
Yes, Councillor Higgins, go ahead.
Thank you, Nikki, presentation. I just asked David Townsend if you've been in contact about recruiting drivers in South Frontenac and Wolf Island. He said he wasn't. I just want to know what the rationale is for your organization going to South Frontenac and Wolf Island, and how do we ensure our funding is being adequately allocated for both organizations for their respective areas?
Thank you for that question, Councillor Higgins. David covers the seniors in South Frontenac Township. We cover all other residents as well as seniors. Seniors that are unable to drive in the south, we have covered those as well.
Nikki, Ron's having a hard time hearing you. Could you speak up just a little? Our audio is not the best here. Is there a way of moving that mic to? No.
Okay. What I was saying is that, is this better? Can you hear me better now?
Yes, it's a bit of an echo, but I can make it out.
Okay, sorry. I'm sorry. We cover all people in South Frontenac, and David covers seniors. So we do need drivers in the south as well to cover third-party rides, children and youth. And we've been helping out David for his seniors that have been unable to secure rides through his agency. We have been able to support those seniors and get them to where they need to go. So the reason we recruit is because we do cover all other rides in that area. Does that answer your question?
I think so. I guess there isn't any boundary issues, I guess is what you're saying.
If I could just add something that we always share. So we're very collaborative. So a week often doesn't go by that somebody from South Frontenac doesn't call Nikki and say, look, we can't get a ride on Tuesday. I don't have a driver. Can you help? So I'll follow up with David, but it appears that we don't have a comfortable working relationship. But I would say that Nikki and South Frontenac staff are pretty comfortable. It's always about the client and getting the client's needs met. The most recent driver that we recruited came from Perth Road, and he had seen the ad in the paper, and we were very open during our interview that he might be interested in contacting South Frontenac and also being available as a driver with them. And he was very new and he thought he would give it a chance. But there's nothing on our end. We don't need to be in South Frontenac. We have more than enough rides. There shouldn't be a competition. Volunteers are scarce and we should complement each other. The islands has never been a conversation with South Frontenac, so very happy to follow up. Gail and I did a tour about 5 years ago and looked at both Howe Island and Wolf Island and determined that Wolf Island, we needed to recruit drivers directly on the island to be able to do those drives because the role would be to get them to the ferry. We haven't successfully recruited someone, although at the township council meeting, they did have a volunteer council member who offered to drive. So we haven't followed up yet with that or heard back from them. We do have 2 drivers that have agreed in our interviews to go up to Howe Island and do rides. So we haven't said any yet, but we are poised and have drivers ready to go. So it should be a seamless system. We're ideally working together, and I guess I have work to do at lunch tomorrow to make sure that we continue to have that positive relationship.
Okay, I'm just surprised that David didn't know about it, so I'll leave it at that. Thank you.
Thanks very much, Louise and Nikki. I don't see any more questions, so I'm sure we'll be back to you when we get through our budget.
Okay.
Thank you.
Thank you.
Okay, I think we got Mr. Pender coming up next. Do we want to take a 5-minute break? We've been here for an hour and a half, I think, so far. So, okay, masks on, everybody. Stand to attention. Go. We have the audio and virtual meeting back online. So the next up is Kelly Pender with his short, no more than 10-minute presentation, briefing. Oh, hey, we're cutting them to 5? Oh, okay. Is that a motion on the floor?
The presentation is in front of you. Are there any questions?
Oh, go ahead.
All I have to do is find the.
Oh, where's the slide? I've got it on my screen, but I'd like it up there. Yeah, here. There we go.
I have to make it big first. There we go. So thank you, everyone. I think I have my marching orders. I will be brief and I'll skip over a lot of the legislative stuff, which is in your agenda package. Our schedule for the last month has been very busy, largely dealing with pandemic related issues around long-term care, paramedics, behavioral health teams. Been a busy month. A couple of updates for the Eastern Ontario Wardens Caucus and Eastern Ontario Leadership Council. And a big shout out to our Fairmount staff, beginning with Lisa Hervey and of course Susan, plus our directors and all of our staff. A lot of our lobbying efforts, advocacy efforts around 4 hours of care, and it started here in Frontenac and Hastings in the city of Toronto. The province has recognized the 4 hours of care. We expect funding announcements soon, but I'd like to think that we were at the forefront of that, and a big thank you to their staff. Should turn on the microphone. Chair Higgins is attending Ontario East, representing the Eastern Ontario Leadership Council, and our advocacy efforts continue with our major projects on transportation, workforce development, and pandemic recovery. The only piece of legislation I will cover, because we anticipate that we'll have our numbers over the next week or so, hopefully before our budget meetings on Monday and Tuesday. The province is making local announcements through their MPP office. And obviously, we don't have a PCFPP, so we may not get ours as timely as others, but the 4 hours of care is moving forward, and it will be built into our budget. Sorry about that. We are tendering for, does that work? The office admin project, as council remember, there are 2 parts to that. The first is covered by a grant for COVID, and that will be the first phase of the front foyer. It's about a $100,000 project. So when you come here in November, most likely in December, we will have alternate access made up. This will make our front foyer socially distanced and provide for a washroom. So we're excited about that project and anticipate completion early in 2022. And thank you to the provincial government for funding that project. Staff vaccination update. We did not go with the mandatory vaccination plan, except in long-term care. We're following the provincial directive. We do have a couple of staff at this point that aren't vaccinated, and they will have until November the 15th to become vaccinated, or they'll be put on unpaid leave. And from a paramedic standpoint, all of our active duty paramedics are fully vaccinated. Anybody that is not vaccinated has to wear full PPE and be tested regularly as per our policies, and all of our admin staff are vaccinated. So we're making good progress there. Social media continues to be strong, thanks in large part to a number of events over the fall, including our Open Farms event, the arrival of the new ferry for Wolf Island, which will be in in the spring. We're anticipating operational in the spring.
March 22nd is the expected
March
date.
22nd. And a number of paramedic tweets and related to Labor Day and of course Queensland. Thank you to Angelique and our staff. We celebrated Orange Shirt Day and National Truth and Reconciliation on September the 30th, and we had 46 members of our admin staff that purchased the shirts. And thank you to the warden, the deputy warden, and to the Grand Chief that attended our little ceremony. Planning update, suffice it to say that planning continues to be strong. The next slide is our graph. As of mid-October, 132% of our 2020 numbers, which was an increase, which was a record year. We continue to set records. Central had over 18 applications at the meeting on Friday.
2 hours worth.
2 hours worth. So we continue to have strong applications in the planning world, and a big thanks to township staff for doing all that they can with the committees of adjustments and zoning applications. HR update, and again, we set another record. We're well past last year's recruitment record. So we're at 485 competitions through October the 12th. We used to think that 200 was a large number. So thank you to Barb and the HR staff. Doing them virtually, we've learned a lot of things over the past year doing virtual interviews and testing, and also have automated our intake process as well as our reference checking, which is helping, but still the demand is strong, and I don't see that subsiding with community paramedicine and the expansion of long-term care. We have 2 arbitrations set, and Barb is preparing for bargaining with both OPSU and QP 2290, OPSU being our paramedics, 109 being ferry operators. And preparation with United Counties of Leeds and Grenville on a joint RFP for human resources management system, which we received a grant from the province for, and Barb will be giving you more of an update next week during our budget meetings. Staff farewells. I think everybody was sad to see Allison leave for a job with the city of Ottawa. She started this week, and we wish Allison all the best in her new job and thank her for her 10 years worth of service. We did give her a 10-year pin. I teased her that her 10 years were on the Sunday, and she retired from Frontenac County on the Friday, so she delayed so she could get her pin. Also, Bob Pritchett, our manager of environmental services, who was a Sodexo employee, as you know, we contract out the management of environmental services, which is all of our cleaning services for the campus and dietary to Sodexo, and Bob left us for a position at St. Lawrence College, and we wish Bob all the best. He came to us at the height of the pandemic, replacing Tom Mercer, and was a wonderful addition to our team. We wish Bob all the best. So with that, if there's any questions, then please answer any questions.
Just a general question, I guess, and for the mayors here too. I know that the islands come out of the gate and said they had a vaccine policy and they were going to be strict. Did any of the other municipalities actually bring one in now, or are we still going by provincial guidelines?
I think some LNA did. I believe Rick said Loyalist.
I'm just talking about our county.
Ours?
Yeah.
Ron, it's Ron Higgins here. We're discussing that on Friday and probably put in a high-level policy.
Thank you.
We're looking at some drafts right now, but I believe the CAOs are also working on it together.
And Councillor Fowler, did you have a question?
The mics aren't working. Dennis?
It's on there. Oh, okay.
Yeah, you
Yeah.
better turn yours on.
I'm just wondering if there any consideration, we're speaking about people that are not vaxxed. How about the people that had COVID? Are they given any consideration because they carry a certain amount of antibodies, or is there any way of testing it? Is this something the province is looking at?
Well, because we're regulated under both the Long-Term Care Act and the Ambulance Act, we don't have any discretion. Those policies come from the province, and there is no discretion other than receiving the vaccination, allergic reaction, or human rights. Those are the only limitations of the province.
Thank you.
Okay, any more questions? Having seen none, we'll move on. Thank you very much, sir.
Thank you.
And I think next on the agenda is reports, and we have a resolution. There's no unfinished business, so we'll just move to reports. You have a resolution to read, Jeanette?
By Councillor Fowler, seconded by Councillor Higgs. Resolved that the Council of the County of Frontenac will receive the report titled Planning and Economic Development Extension of Approval of Draft Plan of Subdivision Partington, County File 10P-2013-002, and further that the Council of the County of Frontenac extend the draft approval for the plan of subdivision for the proposed Partington subdivision for a period of 2 years to October 18th, 2023. And there was a distribution placed on your desks this morning regarding a resolution in the Township of St. Thomas.
Do we have any questions, comments? I'll call the vote then. All in favor?
Oh, wait,
Oh,
I have
sorry.
a question.
Very sorry. Go ahead, Councillor Higgins.
While I was reviewing this agenda and getting ready for it, I kind of understood where the staff were coming from. Since then, during getting ready for this meeting, we got a letter dated October 13th, dated to Warden Vanderwall about concerns from the Canadian Environmental Law Association. To me, that letter made a lot of good points. So I don't like using COVID as an excuse, but I'd like to hear from staff what related to COVID delayed the developer from implementing some of the conditions.
Yes, Joe's going to answer. He's just going to the mic, Ron. Just give us a second.
Through you, Deputy Warden. Can you hear me, Councillor Higgins? It's Joe.
Yeah, I can.
So if you take a look at our staff report, I do, to a sense, explain how COVID has affected this application, but not in isolation though. And you heard Mr. Pender's earlier presentation that the volume of planning applications we are dealing with this year is the highest it's ever been. It was higher than the record-breaking last year, and I can confirm the same is happening in South Frontenac. It's happening all over Eastern Ontario, and the demand for not only our services but the private sector services has had an effect in the delay of this particular application getting done. Having said that, the developer has only been really working hard on this for the last 18 months. But he has been moving forward, and that's why we're recommending that it be extended not only just 1 year, but 2 years, because we expect the volume of applications in 2022 to not really slow down much compared to this year. And as a result, we don't think it's fair to have this come back to council next year asking for another 1 year extension. So we're asking for 2 years. The other comment I want to make is there's the correspondence from the developers. Planning consultant infers that township staff are in part to blame for this, and I do not agree with that at all. I know that township staff have been working very hard on this file, and in fact, part of the delay, quite frankly, is because the consultants working for the applicant, the quality of work has been to a degree that township planning staff have said to say, you got to go back to the drawing board. You've not given us the information we need to make decisions. So, the township staff have actually carried the bulk of this work for the last 18 months, and I want to make sure that our council is aware of that. Thank you.
Thanks, Joe. And Warden Vanderwall has a question.
Oh, I'm not finished yet, Dennis.
Oh, I'm sorry.
You explained quite a bit there, Joe. Thanks very much. Can you explain how come there's a new residence being constructed when the conditions haven't been met yet?
Through you, Deputy Warden. So once you have draft approval on a plan of subdivision for a number of residential lots, if you are the owner, you're allowed to get a building permit for one dwelling, just like you would on any vacant lot that permits a residential use. So that's what's happened, and that is a permitted use. I can advise council that the developer installed the wrong septic system on the property. The conditions required a higher end tertiary system. He has been advised by the township staff that he has to dig it up and replace it with what's required as part of the draft conditions of approval. But that is a standard thing, Councillor Higgins, that you can build one residential dwelling on a lot after draft plan approval.
Okay, thank you very much, Joe. I just wanted to get this addressed in a transparent manner on the matter. Thank you for the explanation.
Okay, we'll move on then to.
The only comment I would like to make, and I'm not defending developers or anybody at this point. However, I have received phone calls from businesses. I've received phone calls from people who are building houses. One MOE call was 3 months, and they told them it would be 6 months before the report is done. So that's just on one business that was looking for a septic system. And you can't get a surveyor, you can't get anybody to do a report. So I'm not defending any developers. I think they could start sooner on the conditions. However, it's almost impossible to get a report within 3 to 6 months.
That answers well, Ron. Thanks.
Councilor Bell.
Thank you, Deputy Warden. Through you to Joe. It's my understanding that in the draft conditions, there was a provision to stagger the wells on site, and I understand that's not actually happened, what's happened in the field. Can you give some context to that and what may be happening and how it will work? Would we amend the draft conditions?
Through you, Deputy, thank you for the question. So it was discovered in the last year that, sorry, let me back up. As part of the draft approval for this subdivision, there was an issue of water quality. And it was raised by the residents at the hearing. As a result, our hydrogeological expert recommended to the board that because the lots are all in a straight line, our expert recommended to the board that the wells be drilled in a staggered fashion. And the reason he recommended that was because if that happened, then there would be less, the technical word is less interference between the wells. They would have less impact of water being drained or disturbed by the neighboring well. We then discovered last year through the residents actually that the wells had been drilled and they had not been staggered. At that point, we had our hydrological engineer contact their consultant, and we had the consultant do well testing to see what happened as a result of the lack of staggering. And again, I don't want to get into, I can, but I don't want to get into a lot of technical detail other than to say they did the testing. The testing was provided to our expert, Mr. John Pike of Melrose Engineering. He concluded that with this new information he had, that in fact there was not going to be well interference the way that they had been drilled, and he was satisfied that that in effect met that condition of a staggered well. So his opinion was, when I was at the Ontario Municipal Board before those wells were drilled, my position was they should be staggered. They weren't, but he had enough information to conclude there wouldn't be interference. Should he had found otherwise, we would have told the developer, you got to start again. So that was the developer doing that on his own without consultation with either township or county staff.
Thank you. Thank you. Any more before I call the vote? All in favor? Carry. And now we have a Frontenac paramedic purchase.
Moved by Councillor McDonald, seconded by Councillor Rebel, resolved that the Council of the County of Frontenac receive the emergency and transportation services transfer from Frontenac Paramedics Equipment Reserve for purchase of computer equipment for new electronic patient care record program for information, and further that council approve the transfer of up to $56,045 of 2022 capital replacement reserves to be used in the 2021 budget year.
Any questions or comments? Yes, go ahead, Councillor Higgins.
Is this basically in advance of the 2022 budget that's being out for?
Yes, it is, Councillor, but in effect, it will save us money in 2022, as the report indicates. So we're suggesting that we move forward with that. The money would have come out of the reserve in 2022, and we're suggesting it come out of the reserve in 2021, which will result in budget savings for the next year.
Okay, so if we approve this today, is this still going to be part of the total budget being presented on Monday, Tuesday next week?
Well, it's part of our capital asset plan.
Okay,
So,
thank you.
Thank you. Anything else? We'll call the vote then. All in favor? Carried. And we got a planning economic development on KMP Trail.
Moved by Councillor Higgs, seconded by Councillor Fowler. Be it resolved that County Council approve the amended Frontenac KMP Trail Management Plan dated October 20th, 2021. And further that staff engage with the Township of Frontenac Islands on phase 7 of KMP Trail development upon the completion of the Wolf Island Canal Master Plan. And further that staff engage with the Township of South Frontenac regarding motorized use of the KMP Trail in the village of Verona upon the completion of the Verona Housing Master Plan. And further that recommendations for revenue generation, if approved by County Council, be added to the KMP Trail Management Plan after County Council receives the report assigned to Mr. Wayne Robinson. And further that staff be directed to create a bylaw to implement and enforce management policies on the Frontenac KMP Trail. And further that subject to regular reviews of costs, the management plan be utilized as a guide for development of operations budget and where applicable contracted services. And I would note that this motion that was on the floor back in September has a motion to amend, which will carry forward to this meeting.
Question?
First of all, we got the warden has a question. We'll get to you, Ron.
Okay.
Only comment I would like to make is I thought the discussion for the Wolf Island Canal Master Plan, I know that the mayor of Wolf Island said nobody wants bikes, but that was fairly general and that was his opinion. And I thought the discussion was that they were going to hold some sort of a meeting on the islands to see what and if they still wanted the canal or they wanted biking transportation or whatever. That's just a comment. The other one I would like to make is, I guess you have to sort of put the word Craig Road in there. I would think that if things change, it might not even be Craig Road. That's where it is now. Doesn't mean it's at the head of the Bell Rock Road. It doesn't mean it's at Craig Road. I would think that it might happen that if four-wheelers are not allowed at Bell Rock Road, they might be taking the shoulder and get off 38 before Craig Road. So I know the language, I guess, has always been Craig Road. Maybe it doesn't hurt anything that it's in there, but I just wanted to make those comments.
Yes, I think Councillor Ron's on the, yes, Councillor Higgins, you've got the floor now.
Yeah, just a question. In the report, it quotes $1,500 per kilometer for trail maintenance. That seems real high to me. I contacted EOTA yesterday or the day before. And going to 2022, the average rate seems to be about $861 a kilometer, not $1,500. So I just wonder if that could be justified to council.
Okay, Kelly?
Our trail maintenance plan is a higher standard than the EOTA. I refer you to the east-west portion in central Frontenac. And that number has been verified both by our project manager and our contract public works employee. So it is a higher standard, and that standard is set out in the maintenance plan. So if we're to reduce the number, we'd have to reduce the level of maintenance.
Very different trails.
What was that, Brandon?
Very different trails.
Okay.
And different costs. Yes, Councillor Fowler, you have a comment, question?
Yes, just wondered about the revenue generation. Where does most of that money come from? Or is that money that's going to be generated through sales of permits?
That's what's going to be decided.
That's what Mr. Robinson is investigating, is whether there is an opportunity to use a permit system either through the EOTA or the ATV Association to help him with the maintenance costs. But that's to be determined.
Yeah. Okay, thank you.
Okay. And Councillor Vella?
Thank you, Deputy Warden. So I had a couple of questions, and unfortunately, I've got something else open up on my screen, so I'm not sure which point it was. One of the points was that we would approve the revenue generating plan that was being approved or submitted by Wayne Robinson. And I wonder if it's not jumping the gun, whether that should be a part of this resolution. I think I would prefer to see the plan from Mr. Robinson first before it's included in this resolution.
I think it says receives the report. I don't think it says we're going to approve it before we receive it.
The actual motion says if approved.
I appreciate that, but it seems to me it's a little presumptuous, is it not?
It was a pretty big word.
If we're not considering it, why are we doing it? Right? If we're not considering approving it, then why go to the effort of doing it?
That's fair, but I just seems a chicken and egg situation, I guess. Anyway, second point, Deputy Warden. I note in the appendix 3, where it's talked about all of the language associated with where the motorized vehicles have access to. We now have a yellow note in there highlighting the fact that the trail may open from Bellrock Road North. And I just find that a bit offensive, frankly, that we're approving a trail plan, a master plan. We're not providing a guide for individual users. I just think that's unnecessary to have that included in there. Thank you.
Okay. Thanks, Councillor McDonald.
Yes, I just want to make a comment that if in fact, when we get the report in regard to suggesting revenue raising permits or whatever, I would like to make sure that we certainly go public with that, because I think that will raise a lot of controversy in the using of the KFP if people actually have to buy an annual pass to use the trail, considering that there's probably members of families that might have 4 or 5, say, ATVs that they would want to use at the same time. So it might become very expensive for family use, but I look forward to seeing the report. But my concern is that we go public with that approach so that everybody's aware of what we're trying to achieve, and also make public what the cost of maintaining this trail is and the rationalization for looking at other sources of revenue to accommodate. Thank you, Mr. Chair.
Thank you. Councillor Fowler?
Yes, also in this report, I think they mentioned the benefits for the local communities. Only 2 communities that I can think of in our area would be Sharbert Lake up to Calabogie. There's really no community in that area that would benefit that I could see that was in the report.
I disagree with that, Councillor Fowler. Having the trail coming through North Frontenac is going to allow us to expand into the rest of the North Frontenac. So there is definitely a community benefit.
Well, when I see all of the different things that were mentioned in there, there's none of them in place in that area where I am at Snow Road.
Okay, if there's no more, I got a couple of comments. I would ask the warden to take the mic.
Sure.
Sure.
Yes.
Yeah, in response to your question, we did review that locally as far as the bikes, and we passed a resolution asking that it not be part of the master plan. Which leads me to the point on this map. We should take that line off that shows the bike path that's on page 43 of 53. And I think there was another one I picked up at the end, page 47 of 55 of the management report. It reads the snowmobiles have access to the entire Frontenac KMP trail during winter months. This access requires a valid permit issued by the Ontario Federation Snowmobile, and trail is maintained and patrolled by the club, etc. Well, I didn't think that was the entire trail. I thought it was north of Craig Road. They can go right down to the city boundaries on snowmobiles?
My understanding is at least to Horseshoe Road.
Want to elaborate?
I didn't leave you high and dry there. Just taking notes. Thank you, through you, Mr. Warden. Shortly before I joined the county in 2016, council passed a resolution allowing snowmobile access all the way to Orser Road on the KMP Trail. So in the winter months, there's motorized access on the entire mainland trail.
Is Orchard Road the city line?
That's correct. Orser Road is where it is the city limit, and the KMP becomes city trail south of there.
Okay.
Okay, I'll turn it back.
Yeah, thank you. Oh, Councillor Fowler.
Sorry, I was just wondering, has there been any environmental impact study on the KMP trail, especially where it affect a noise study or the value of loss enjoyment of people that are on the trail or near the trail of losing enjoyment of their property?
Richard, do you have an answer?
We have not been required to conduct any sort of study.
To me, this seems to be a very important thing to have. You know, if we haven't done a study like this, it's going to be affecting a lot of other people in a negative way.
But the trail was there before they got their property, right? You knew the trail was there when you bought the house?
Well, there's a lot of property on the KMP trail that people have owned for generations prior to the railway going in, and they have bought it back. And I'm just I'm concerned about some of their issues too. I have people approaching me with these issues, and that's why I'm bringing them up.
Okay. Any more questions, comments? If not, I'll call the vote. All in favor? Carried.
Through you, Deputy Warden.
I assume Councillor Higgins, you're in favor? Maybe we lost them.
Oh, sorry, I was on mute. Yes, I'm okay with it. I'll only pipe in if I object to the motion. If you don't hear from me, I approve.
You approve. Okay, I just want to make sure you're still online. Okay.
It's an amendment.
So I just would note that that is carried as amended. So the amendment that was made at the September council meeting will be included in that motion.
Okay.
I oppose.
Right, it's not recorded.
I think the next one is the corporate services, Howe Island ferry fees.
Second.
Fred, your mic is on.
Moved by Councillor Smith, seconded by Warden Vanderwall. Resolved that Council of the County of Frontenac receive the corporate services Frontenac, Howe Islander, Ferry, fees, and settlement report. And further that a bylaw be introduced later in the meeting to adopt the 2022 Frontenac, Howe Islander, Ferry fees and fare schedule.
Any questions? All in favor? Carried. The LiDAR acquisition.
Moved by Councillor Rebel, seconded by Councillor McDonald, be it resolved that the Council of the County of Frontenac receive the LiDAR acquisition report for information, and further that the Council of the County of Frontenac support the acquisition of highly detailed and accurate LiDAR mapping for the Frontenac region, and further that Council of the County of Frontenac authorize staff to enter into an agreement with the four conservation authorities, being Rideau Valley Conservation Authority, Mississippi Valley Conservation Authority, Cataraqui Region Conservation Authority, and Quinte Conservation for LiDAR acquisition, and further that the Council of the County of Frontenac support the county being the lead applicant of a joint application being submitted to the Municipal Modernization Program Intake 3 on behalf of the four townships to cover a portion up to 65% of the costs associated with acquisition and storage. And further that if the application for municipal modernization funding is successful, that council authorize the warden and clerk to enter into a transfer payment agreement with the province of Ontario. And further that the remaining $23,000 of the project be funded from the levy. And further that if the application for municipal modernization funding is unsuccessful, that the additional funds be expensed from the stabilization reserve.
Any questions or comments? Yeah, yes, Warden Vanderwall.
I guess maybe I could have read it or should have saw it, but what is the total cost then? If 23%, 23,000 is unfunded, what's the total cost to acquire it? If no funding?
The budget is on page
130,000 or
so it's
something.
120,000 for the actual LiDAR.
Right.
And then 10,000 for the hardware support.
Okay, and then it says that if the remaining 23,000 of the project be funded from the levy, you're just putting it into the levy, or why wouldn't it just be asked from the municipalities that all agree to go in anyway without adding it to a levy and just say each portion is just like we do with population on all the other stuff? That would be simpler than throwing it into a levy.
Well, if we don't receive the grant, then the county will pay 50%, and the township will pay 50% based upon the number of parcels within their municipality. And that's how we divvy up GIS fees. So if you can, it's based upon the number of parcels. So not.
But I don't know, it just says added to the levy, so that, I just thought it's simpler just to say, okay, well, you owe, instead of throwing it into a levy. It seems like once it gets into a levy, that percentage is in there and it just keeps going, but anyway. That's fine.
Okay, anything else? I'll call the vote. All in favor? Carry. And I don't think we have any other reports. So I think we're ready to move back into the regular council.
Moved by Councillor Higgs, seconded by Councillor Smith, that council revert from committee of the whole council to council.
Questions? All in favor? The mic is yours.
Thank you. Adoption of the report of the committee of the whole.
Moved by Deputy Warden Doyle, seconded by Councillor Fowler, is that the report of the committee of the whole be adopted and the necessary actions or bylaws be enacted.
All in favor? Carried. Anyone giving notice of motion? None. Communications? That's anything from communications? Other business, public question period? Anyone from the public? Bylaws.
Moved by Councillor Rebel, seconded by Councillor Fowler. Resolved that leave be given to the mover to introduce bylaws A through C that have been circulated to all members of County Council, and that bylaws A through C be read a first and second time.
First and second, all in favor? Ferry.
Moved by Councillor Rebel, seconded by Councillor Fowler, that resolved that bylaws A through C be read a third time, signed, sealed, and finally passed.
Are there any questions? All in favor? Carried.
Moved by Councillor Higgs, seconded by Deputy Warden Doyle, that the meeting hereby adjourned at 11:45 a.m.
All in favor? Carried. Thank you.
Thank goodness.
That's all the gotcha.
Control some of those site briefly.
Wow, yes, no control. With the preemptive warning.
Thank you very much for allowing me to
I want to stay a little longer.